It's always incredible to me to see the demonstrations of our frontline VA employees, all the innovation that they bring to the table, all of the things that they're doing to make it better for our service members, our veterans, and our families. And as a veteran, thank you for what you're doing. It's just an incredible experience. Ryan and I have been genuinely talking about how great it is to see all the... Ryan, what's with the tuxedo?
You said dress up for the award ceremony.
I actually said, don't screw up the award ceremony, but I got to tell you, you look great.
Well, Innovation Experience is kind of like our Mardi Gras. It's a big celebration of all the incredible work going on across the VA. And you saw from our demos just how passionate and how much of a difference these employees are making. So, I think the theme's actually quite fitting.
I like it. It is a celebration. And I got to tell you, celebrating every day, the excitement that comes with this stuff, it just makes your day. So I guess you're ready for the rest of the afternoon, and perhaps you can turn it over to our leader that's going to take us home.
We are. Without further ado, we'll bring Dr. Clancy back to open up the 2020 Innovation Experience Award Ceremony.
Greetings. I'm Dr. Carolyn Clancy, the Assistant Undersecretary for Health for Discovery, Education, and Affiliate Networks. I want to personally thank you all for having joined us for the 2020 Innovation Experience. Your active and dynamic participation in this virtual event has made it engaging, inspiring, and enormously successful. I'm also very excited and deeply gratified that this national gathering exemplifies what Innovation Experience is all about, delivering more together for our veterans. The Innovation Experience is unique in that it brings together the best innovation minds and talent to celebrate not only our many accomplishments, but just as importantly, the struggles and resilience we all experience in this shared journey we call innovation. Every year, Innovation Experience reminds us of why we're here and why we do what we do every day for veterans. It underscores the power of partnerships and the key actions we must take to actualize innovation in the workforce and build an innovation nurturing culture at VA and VHA. As Dr. Ryan Vega, Executive Director of VHA Innovation Ecosystem, really commented, delivering more together is at the heart of who we are and what we do. It's part of our innovation DNA and is intrinsic to VHA, IE's North Star, to change and save veteran lives. That same North Star has guided us over the past 3 days. We've been challenged by some of the top thought leaders in innovation to up our game, to be part of a movement that is far greater than any one innovator, a movement that inspires all of us to deliver world-class healthcare for all those who have sacrificed and borne the battle, our veterans. Before we get to the awards, I would be remiss if I did not acknowledge the organizers of Innovation Experience. There are too many of you to thank individually for your contributions, but over the past few days, we have seen and experienced the culmination of hundreds of people's hard work and dedication, a testament to your commitment to mission-driven innovation. Please join me in giving a round of applause for the passion, the leadership, and commitment of Dr. Vega, his team, and VHA Innovation Experience's many partners in organizing and convening this year's Innovation Experience. During this award ceremony, my fellow VHA leaders and I want to recognize the top innovators from the healthcare system and present the results of the 2020 Shark Tank competition, the VHA Innovators Network Awards, and the Innovator of the Year Award in remembrance of Dr. Robert Jesse, former Principal Deputy Undersecretary for Health. To kick us off, we have Mr. Blake Henderson, the Director of Diffusion of Excellence in the VHA Innovation Ecosystem, to present the highly anticipated 2020 VHA Shark Tank competition results.
Are you on now?
Hi, everybody, and thank you, Dr. Clancy, for those wonderful remarks. We're very pleased now to share the results of the 2020 VHA Shark Tank competition. Thank you for everybody who tuned in yesterday and cast their vote. First off, we're going to recognize someone who told their story extremely well yesterday and made a big impression. Congratulations, Mr. Robert Bankston of EMS Clean Covers. And you are taking your practice to not just 1 or 2 facilities, but to 2 VISNs, to VISN 8 VA Sunshine Healthcare Network, as well as nearby VISN 12 VA Great Lakes VA Healthcare System. Next up, congratulations to Amanda Simone and the strong team behind Embedding Physical Therapy in PACT. Your practice will be going to Augusta and VISN 7, Charlie Norwood VA Medical Center, as well as VISN 16, Southeast Louisiana Veterans Healthcare System. Next up, Telelactation Program. Congratulations to Cody Giovanetti. You'll be taking your practice to Columbia, South Carolina, William Jennings Bryan Dorn VA Medical Center, as well as VISN 10 in Cleveland, VA Northeast Ohio Healthcare System. Next up, congratulations, Kevin Kelly. You'll be taking Virtual Integrated Primary Care Mental Health Integration Hub. We're going to talk about that name. Onto VISN 6, Asheville VA Medical Center, as well as VISN 8, Orlando VA Medical Center. Next up, Sue Kerber. Congrats to Voluntary Service Curbside Delivery. You'll be taking your practice to the desert, not a food desert, but VISN 22, Phoenix VA Healthcare System, to work alongside their Veggies for Vets program. Next up, congrats Kelly Cruz of Drive-Thru Vaccination Clinic. You'll be taking your practice to VISN 7, Charleston Ralph H. Johnson VA Medical Center, as well as VISN 16, another practice for Louisiana. Next up, congratulations to Marcus Johnson and his practice, increasing access to clinical research using an innovative mobile recruitment approach, the MORE concept. You'll be taking your practice to the research powerhouse region of Boston in VISN 1, West Roxbury campus. Next up, congrats to VISN 20 Centralized Lung Cancer Screening Program and the winning bid, VISN 4 VA Pittsburgh Healthcare System, University Drive. Congrats to Beta Lactam Allergy Assessment, saving lives 1 assessment at a time, and the winning bidder here in Washington, D.C. in VISN 5, Washington, D.C. VA Medical Center. And finally, our last winner and winner of the popular vote with over 1,000 votes. Congrats to Kyle Nordrum and the remote temperature monitoring and amputation prevention through telehealth, and the winning bidder in VISN 16 of Central Arkansas Veterans Healthcare System, which has a great record with diffusion of excellence. So congrats to all our winners, to all our finalists. We thank you. You did an outstanding job and represented yourselves and your practices extremely well. And thanks to our audience and especially our sharks and leaders out there. We appreciate you joining us for the 2020 VHA Shark Tank competition.
Thank you, Blake, and congratulations to the Sharks and the newest batch of Diffusion Fellows. You're sure to have an incredible year stretching ahead, working with Blake and his team. Now, my friends, we are going to shift perspective from the future and move into a look back over this past year within the VHA Innovators Network, INET, as we affectionately call it. I'm Bryn Cole, INET's Director of Programming, and my co-director and I are so pleased to be able to recognize 3 exceptional VA employees, each leading unique efforts to improve the lives of veterans and their fellow employees by their work within the INET program. First, a little background. Allison?
Thanks, Bryn. I'm Allison Emrine, Director of Operations for the Innovators Network. For those of you unfamiliar with our network, INET is a group of 33 VA medical centers throughout the country that concentrate on employee-driven, veteran-focused innovation. INET supports both the design and development of employee-generated innovative solutions. but also the education of thousands of employees in innovation-related competencies, such as human-centered design, lean startup, storytelling, the three-box solution, and more.
And now we are glad to present the annual iNet Awards to 3 individuals who have excelled in the work that Allison just described. The 2020 Innovation Specialist of the Year, the 2020 Investee of the Year, and the 2020 Tanked Award. First up, the Innovation Specialist of the Year. Each Innovators Network site is equipped with a highly trained innovation specialist who leads their facility's local innovation program. As VA Medical Center employees, backed with iNet training and resources, innovation specialists are well positioned to understand the on-the-ground challenges and then meet them with a cadre of innovation-related methodologies and approaches to aid frontline employees in developing creative solutions. We are proud to present the 2020 Innovation Specialist of the Year Award to Julie Whitney, Innovation Specialist for the North Florida, South Georgia VA Healthcare System.
It's my distinct honor and privilege to recognize Julie Whitney, and as she's received this award for the Innovation Specialist of the Year in 2020. So, you ride the horse.
Congratulations, Julie. Julie has molded her local program into an employee engagement machine. Thanks in part to her understanding of human-centered design and employee empowerment, and because of incredible local leadership support in all her innovation-related activities. She is a powerful influencer at her facility, which enables her to connect with employees on many levels and recruit them into iNet programming. She is a frontline employee, a nurse, who understands and listens to the problems of her peers. This gives her powerful insight into how to support employees as they travel along their innovation journey. Next up, when an employee enters our Spark Seed Spread Innovation Investment and Accelerator programs, they earn the title of Investee. This year's winner, however, has also earned the 2020 Investee of the Year Award title.
Congratulations to Terry Olinger from the Cincinnati VA Medical Center.
Hi, I'm Terry Olinger, and I'm proud to have been selected Investee of the Year. And I'd like to thank Lindsay Reigler, my innovative specialist, as well as Bryn Cole and Allison Amrine from iNext. They all helped me bring my idea from a piece of paper to fruition. Thank you.
Congratulations to Terry Olinger from the Cincinnati VA Medical Center. Terry is the model early stage investee. She has continuously iterated on her design through the process of prototyping and obtaining and integrating user feedback. Terry saw a problem, one that had no readily available solution, and rather than giving up and moving on, she turned that observation into a drawing, and then that drawing into an incredibly successful collaboration between herself, veterans, and engineering students from the University of Cincinnati. Terry's prototype, Droppies, is patent pending and has received another iNet investment for this coming year. We are so very proud of Terry's achievements and can't wait to see how Droppies continues to evolve and advance in the years to come. Finally, the Tanked Award. Make no mistake, Tanked awardees have not failed nor tanked. They have displayed high levels of foresight and awareness. living so in the moment and in touch with the needs of their end users that they are able to pivot when their solution has the opportunity to follow a new path, either based on new learning or massive shifts to the environment or market. They aren't afraid of straying from their original solution because they know that pivoting is sometimes the best thing to do, even if they aren't in danger of tanking.
Please join us in congratulating Charles Franklin from the Boston VA Healthcare System 2020 Tanked Awardee.
I'd like to say thank you to the Innovation Network for this recognition and award. It really means a lot to me. And a special thank you to Samantha Sissel, Dr. Amanda Purnell, Crystal Woolen, Allison, and Bren. Thank you all for your support in this. And most importantly, thank you for the opportunity to pivot my project and really meet the needs of the veterans during this pandemic. A special thank you to my family, my wife, Julia, and my 2-year-old daughter, Haley Jane. Every time my phone would ring, she'd be like, "Is that Arpan?" Arpan's a little bit of a celebrity in our house. He's with our Architecture Solutions team. Really did a tremendous job supporting this rideshare project. And without you and the Architecture Solutions team, this wouldn't have been possible. But most importantly, I really want to thank all the sites out there that participated in this project. I really enjoyed all your innovative ideas and your support with this, from Manchester, New Hampshire, Connecticut, St. Louis team, the Colorado team, Melissa Meredarks and your Vision 21 leadership, and your 5 sites in Vision 21. And then San Francisco, who did this as a standalone. Thank you all. You did a tremendous job, and you really should be proud of yourselves, especially the way you handled this pivot. So again, thank you.
Charles' rideshare initiative was cruising along nicely, pun intended. It was originally developed to support homeless veterans by helping them get to job interviews, find housing opportunities, and prevent cancellation of medical appointments. Then boom, COVID. Due to the shutdown and many of the original uses no longer needed, Charles and his team leveraged the rideshare network to deliver food from food banks, essential equipment, donated masks, gloves to families of high-risk veterans, veterans in HUD-VASH, transitional housing, and homeless veterans off the streets or out of overcrowded shelters and into hotels. Rideshare provided over 40,000 rides such as these since March of 2020 and is still going strong. That is a tremendous accomplishment and return on pivot investment. Thank you so much, Charles.
As we sit on the cusp of formally launching our newest cohort of Sparkseed Spread projects, I can't help but marvel and wonder about the 2021 achievements that have yet to be made. We are deeply proud of the efforts of all of our frontline employee innovators and innovation specialists, and are looking forward to another incredible year. Now, let's send it back to the National Press Club, where Dr. Clancy will announce the Dr. Robert L. Jesse Award for Excellence in Innovation, the highest honor given during our awards ceremony.
The Dr. Robert L. Jesse Award was established in 2019 to honor Dr. Jesse, who was appointed Principal Deputy Undersecretary for Health in the Department of Veterans Affairs on July 4th, 2010. Prior to his appointment, Dr. Jesse had served as the acting Principal Deputy Undersecretary for Health for 4 months. Dr. Jesse was also the Chief Consultant for Medical Surgical Services in the VA Office of Patient Care Services and served as the National Program Director for Cardiology. In this capacity, he implemented broad reforms in the delivery of specialty, subspecialty, and emergency care that have significantly improved the quality of care provided across the VA healthcare system. Dr. Jesse's career vision, commitment, and dedication to innovation were noteworthy during his tenure at VHA. The Innovator of the Year Award recognizes and honors VA and VHA employees who have demonstrated excellence and enabled the discovery and spread of healthcare innovation that is delivering more together to change and save veteran lives. This year, we received 3 times the amount of nomination. Each nominee was outstanding. The 3 finalists have implemented creative and innovative approaches to promote health improvements across the enterprise in support of mission-driven innovation. They have a vision and have been a catalyst for the advancement of care delivery and service. These finalists have also collaborated within their community by establishing relationships with other strategic partners in government, industry, and academia. Our finalists also understand the power of teamwork and engage their healthcare colleagues and frontline staff members in building relationships through trust, through respect, and knowledge of innovation principles. Finally, the finalists have developed and effectively replicated an innovative process or solution that has positively impacted the value of care veterans receive.
Well, good afternoon. It's a pleasure to be here with you today, and it's been so wonderful to see and hear about the innovative advancements happening at the VHA, some of which have been presented over the last couple of days. My name is Janice Jesse, and I had the honor and good fortune of being married to Bob Jesse for over 40 years. I was so lucky to have a front row seat to see how his fascinating and brilliant mind saw things in a big picture and visionary light. I know firsthand how much care and dedication he put into improving the care across all of the VA healthcare system throughout his 30-year career with the VA. After Bob's passing in 2017, we established a nonprofit organization in his honor, the Jesse Family Foundation, where we strive to carry on his legacy by adhering to his key values as a family man, friend, physician, colleague, and mentor. Our goal at the JFF is to empower today's healthcare visionaries to push the medical boundaries of tomorrow, which aligns so well with this award. To see the Robert L. Jesse Award for Excellence in Innovation, established by the VA in Bob's name, means so much to me and my family. Knowing that his legacy continues to inspire others is a tribute to his memory and one that would make him proud. I'd like to offer a huge thank you to all who dedicate your work towards a brighter future, and a hearty congratulations to all of the finalists for this award. So continue to dream big, be creative, and embrace the spirit of innovation. Thank you.
We would like to recognize our first finalist for the Dr. Robert L. Jesse Award for Excellence in Innovation, Ms. Melissa Oliver. Ms. Oliver is Program Manager and Section Supervisor, Assistive Technology and Rehabilitation, Development of PM&R at the Central Virginia VA Healthcare System in Richmond, Virginia. Melissa is a primary catalyst for the innovative application of 3D printing technology throughout VA. Since 2010, Ms. Oliver has worked to expand 3D printing capabilities by leveraging telehealth service agreements with VA medical centers across the country and assisting with program development. Her work was instrumental in the selection of McGuire VA Medical Center as one of 3 VHA medical facilities that will participate in the expansion of 3D printing capabilities as part of the VHA Agile Design and Production Transformation, also known as ADAPT initiative. As a member of the advisory board for the Commonwealth of Virginia's Department of Aging and Rehabilitation, Melissa regularly presents about engineering and 3D printing best practices. She also partners with state services on 3D printing projects and regularly represents VHA and the McGuire VA Medical Center at national professional conferences for occupational therapy, rehabilitation engineering, and innovation. Ms. Oliver is extremely effective in disseminating 3D printing innovations to both internal and external stakeholders. Melissa provides training and co-treatments with therapy providers in an effort to identify solutions that help veterans maintain their highest level of independence and quality of life. Additionally, Ms. Oliver spearheads collaboration efforts related to medical modeling, a rapidly expanding field with the potential to transform healthcare as it relates to complex orthopedic reconstruction, tumor resection, implantable devices, prosthetics, daily living aids, and so much more. As a member of the VHA 3D Printing Advisory Committee, she is collaborating on a national network that will provide all veterans access to 3D printing to augment clinical care. In response to the COVID-19 pandemic, Ms. Oliver championed efforts to create intubation boxes for emergency departments, as well as laser cut and assemble over 15,000 face shields to be distributed nationally. Now we would like to recognize our second finalist for the Dr. Robert L. Jesse Award for Excellence in Innovation, Mr. Rory Cooper. Dr. Cooper is Director of Human Engineering Research Laboratories at the VA Pittsburgh Healthcare System in Pittsburgh, Pennsylvania. Dr. Cooper is a serial problem solver and innovator. As the director of the VA PHS Human Engineering Research and Laboratories, Dr. Cooper has dedicated his career to transforming and improving healthcare for veterans and all Americans. With over 25 patents awarded or pending, Dr. Cooper has successfully demonstrated what innovation, leadership, and collaboration can accomplish. His inventions are used by over 100,000 veterans, and nearly all are commercially or available or fabricated in VA. For example, Dr. Cooper invented and patented a joystick used in virtually every electronic-powered wheelchair in the world, affording tens of thousands of veterans independent-powered mobility. Working closely with the VA Office of Technology Transfer, Dr. Cooper also created the Technology Transfer Assistance Project, which helps transform ideas to improve healthcare by transforming medical devices into fully functional prototypes that can be licensed to companies and used to assist veterans and VA frontline providers. Dr. Cooper also established the State of the Science Symposium series in 2004, which fostered collaboration and knowledge translation among research, military, and VA frontline providers. To date, over 5,000 people have participated, including residents, fellows, practicing clinicians, scientists, and engineers, and that series continues to this day. In response to the COVID-19 pandemic, Dr. Cooper led the VA Pittsburgh Health System and Vision 4 efforts to create COVID-19 nasopharyngeal test swabs. Utilizing selective laser sintering 3D printing technology, VA was able to generate an inventory of 20,000 swabs, the first and largest in the country. Dr. Cooper has been a leader in transforming the VA through an innovative, collaborative, and effective mission and a tireless effort that has helped countless veterans nationwide. Our third and last finalist for the Dr. Robert L. Jesse Award for Excellence in Innovation is Dr. Leonie Hayworth. As the VA Director of Synchronous Telehealth at the VA San Diego Healthcare System in San Diego, Dr. Hayworth's most notable successes include the development, implementation, and clinical adoption of real-time telehealth solutions, such as the ATLAS, Accessing Telehealth Through Local Area Stations program, and VA Video Connect. The ATLAS program allows veterans residing in rural or otherwise isolated communities to connect with VA providers via VA Video Connect for their healthcare appointments by providing safe, secure, and private locations close to home with free broadband internet access. In response to the COVID-19 pandemic, Dr. Hayworth championed efforts designed to provide clinicians and care teams with the resources necessary to successfully transition care to VA Video Connect. One such resource was the VA Video Connect Strong Practice series, which highlighted best practices and excellence as it relates to the use of VA Video Connect to improve veteran care. The weekly email series provided VA staff members the opportunity to learn from and collaborate with colleagues. Dr. Hayworth also worked to ensure that clinicians who were quarantined due to exposure to COVID-19 were able to continue seeing patients through VA Video Connect. Between February and May of 2020, these efforts led to an increase in VA Video Connect usage from approximately 10,000 to 120,000 appointments a week. Finally, this year's Dr. Robert L. Jesse Award for Excellence in Innovation goes to an individual who has worked tirelessly to transform how VA delivers care through telehealth. In collaboration with VA employees and leadership, as well as external partners, this year's winner champions efforts to expand community-centric telehealth services that increase access to care and enhance overall veteran quality of life. Without further ado, please allow me to introduce this year's winner, Dr. Leonie Hayworth. Dr. Hayworth's eagerness to innovate, collaborate, and lead, all while keeping veterans at the center, make her a natural selection for the Robert L. Jesse Award. Congratulations, Dr. Hayworth, on your significant achievement, and thank you for your dedication and commitment to improving the care of our veterans. Let's congratulate and give a huge round of applause one last time to all of our award winners at the 2020 VHA Innovation Experience.
Thank you. Thank you so much, Dr. Clancy. Hi, everyone. I'm Dr. Leonie Hayworth, VA's National Synchronous Lead for Telehealth Services, and I'm honored to be recognized for the Robert L. Jesse Award for Excellence in Innovation. I've never had the opportunity of working directly with Dr. Jesse, but I have many colleagues who simply refer to him as Bob. I am told that Bob was a man who was always looking towards the future and often dreaming about what was possible. Dr. Jesse had a passion for the people part of medicine. He believed that a personal relationship with the veteran was just as important, if not more important, than the technology or IT infrastructure in place. That's the same belief at the core of our work today within the Office of Connected Care. Caring for our veterans throughout the coronavirus pandemic has allowed VA to think outside the box when it comes to caring for veterans while outside the four walls of a VA facility. In FY20, VA provided more than 3.8 million video appointments to veterans located inside their homes. That amounts to over 1.1 million veterans who were able to maintain physical distancing while reducing their risk for COVID exposure. So far this fiscal year, VA has provided over 5.6 million episodes of telehealth care to over 1.6 million veterans. That's a 117% increase from 2019. None of this would have been possible without a personal connection to each of our veterans, their families, and their caregivers. Within the last year, VA's Office of Connected Care has also increased our iPad program and created a partnership with Apple, expanded our Accessing Telehealth Through Local Area Stations or ATLAS initiative, and launched tele-ICU facilities. These innovations are just some of the ways we are advancing Dr. Jesse's legacy. I accept this award on behalf of the many VA staff I have had the pleasure of working with, and who every step of the way would have made Dr. Jesse so proud in defining the ingredients making up innovation. Here's what you have taught me. Innovation is listening. Innovation is embracing problems as opportunities. Innovation is saying not yet instead of no. Innovation is admitting that your idea could be better than mine. Innovation is letting others take the credit. I want to wrap up by extending a special thanks to our leaders at the Office of Connected Care. Dr. Neil Evans, who, like Dr. Jessie, likes to dream big and dream the art of the possible. And Dr. Kevin Galpin, who understands that we win with technology when we win the hearts of our users. Also, thank you to Dr. Susan Kirsch, whose big heart and generosity have opened the doors of opportunity for so many. To Deborah Shear, who turns the art of the possible into an incredible reality. Dr. Angie Denatolis, mentor and teacher. Dr. Timothy Dresselhaus, whose willingness to share credit makes the whole team feel like they are winning. Dr. Stephen Simon, who appreciates that problems are opportunities to create and to innovate. And the whole team of the Office of Connected Care, truly whose hard work makes innovation across all of VA possible. The technology may change, but the heart of all of those within VA's Office of Connected Care never will. Thank you.
I got to admit, Joe, you look pretty good.
Sometimes I can dress up and make it work, and Ryan, I just want to be like you. And I think there's a lot of people out there that want to be like you in this whole innovation lead. They want to take a part in it. They want to get involved. I just want to be like you.
Well, as we finish this event, what's one thing you take away from these past 3 days, Joe?
I take away passion. I think that many people are always wondering, you know, is the VA that organization that is stuck in the past? Is the VA an organization that's been around for a long time? Is the VA that organization that's just kind of business as usual? And the answer is not at all. This has been exciting to see that the passion and energy and excitement and innovation that comes from our employees, from our service members, our veterans, it's a privilege to be a part of this. And I want to thank you for letting me be the captain and the anchor through this. It's really been a great opportunity to see what you're doing. So Ryan, what was your big takeaway?
Well, I think I can echo all of your comments, and this really is a celebration. I think it's also important to remember that 2020 has been a very challenging year for a lot of us, and we're still going through a lot of challenges. We're in this together. Stay safe, wear a mask for one another, and we'll see you back in 2021 at the VHA Innovation Experience.
Ryan, I can't agree with you more, and it's important that everyone stay safe. Take a look and make sure that you're taking care of each other. There's a lot of loneliness out there. There's a lot of isolation. This has been a real treat to be here with people in person and to get a chance to spend time with you. You know, the Secretary has a connection back to New Orleans as well, so there's a lot of New Orleans flavor. And we were there before last year.
That's right.
So this is a